Hi, I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute, which is the educational arm of the Leapfrog Group. Leapfrog is an independent nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. Today, I want to talk to you about something very simple, but it's also very powerful. And that's how you tell your doctors about your symptoms. When you go to the doctor, what you say matters more than you might realize. In fact, most doctors figure out what's wrong based on mostly what you tell them, not just on your test or x rays. So the clearer you are, the better they can help you. This is especially important for those who are 55 years and up, as you usually have more than one doctor. Here's an easy way to remember it. Be specific, be honest, and be organized. First, be specific. Don't just say, I don't feel good. Tell them what hurts, where it hurts, when it started, and what it feels like. For example, instead of saying my stomach hurts, you could say I have a sharp pain on the left side of my stomach. It started 3 days ago. It feels worse after I eat and better when I lie down. That will give your doctor real clues they can work with. Second, be honest. It's natural to feel embarrassed about your symptoms, but remember, doctors have heard and seen everything. Don't leave things out because you think it's not important or because you're worried it's going to sound silly. An example, if you sometimes get dizzy after standing up, even if it only happens once, tell them anyway. Tell them I notice when I stand up too fast, I feel lightheaded for a few seconds because those small details can really be important to your diagnosis. Third, be organized. Before you visit, write down when the symptoms started, how often it happens, anything that makes it feel better or worse, any new medications you might be on, supplements, or changes in your life. Now, you don't need to write a novel. Just a few notes will make a big difference. So here's kind of a cheat sheet you can remember the acronym OLD CART. O, onset. When did it start? L, location. Where do you feel the pain or the symptom? D, duration. How long did it last? C, characteristics. What does it feel like? Is it sharp, dull, burning? A, aggravating factors. What makes it worse or better? R, relieving factors. What makes it better? T, timing. Does it happen at a certain time of day? You don't need to memorize the old cart. Just think about covering the basics. So let's kind of do a little quick comparison. Something that's not specific. I get headaches. Specific and helpful could be I got a pounding headache behind my right eye every afternoon around 3 p.m. And it only lasts a couple of hours and it feels better if I'm in a dark, cold, quiet room. See the difference? There are several online symptom trackers you can also use, like WebMD or Mayo Clinic, that I use with my clients sometimes that can be helpful. So finally, speak up. If something does not make sense when your doctor talks to you, ask questions. And if you forget something during the visit, you can either call later and add it or go into your patient portal and send them a message. Remember, this is your health. You are the expert on how you feel, and the doctor's there to help, but they need good information from you to do the best job. So, in short, be specific, be honest, and be organized. It's one of the best things you can do to take charge and be proactive your health and help your doctor take the best care of you. Thank you for listening. And remember, no one knows your body better than you do. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have any questions for me as a patient advocate, please visit me on my website at www.hughesadvocacy.com. Thank you and have a great day.